Now, the public protector has found the healthcare system in the country is crumbling. She carried out an investigation into public hospitals in Limpopo, in Mpumalanga, KwaZulu-Natal, and in Gauteng. Her report showed staff shortages, poor infrastructure, dilapidated buildings, and lack of laundry services. Nursing unit Denosa says the report confirms what it's been raising for years now. The union's Mandla Shabangu joins us now for more. Mandla, very good morning. Thank you so much for joining us this morning. So, at the present moment, do you feel vindicated after you've been, you've been speaking about this for such a long time?
Good morning to you and your viewers at home. Indeed, we feel very vindicated because we've been raising this matter as back as 2010. And what makes it to be very disappointing is that at some stage I wrote to the Human Rights Commission to intervene, but all that failed because they wanted me to prove that institutions were not safe, patients were not safe, which I felt very strong that once we raised these issues, especially when there were killings in the hospital facilities, the Human Rights Commission will take it upon themselves to go and investigate on their own. But instead, they wrote back to me to say they want the facts even of a patient who was killed. Now, we feel that the public protector's findings are confirming the situation which is about to explode of the health system in this country.
So, Mandla, the public protector has vindicated your call, yourselves as Denosa, but there are so many issues that are still on the table. We're talking about staff shortages among those. But what next for you now as Denosa? What happens after this report?
This report, it guides the way forward now, because what has been happening, especially with the staff shortage, we have a situation where the government is saying we want to reduce spending. And we are of the view that as a responsible government, you cannot reduce spending on health matters. The Department of Health should be the one that should not have any cuts. But what led to this is this moratorium that was issued by the provincial treasurer of KwaZulu-Natal that there should be no employment of what we call non-exempted posts, which led to this crisis that we are in, because when you vacate the post, either through retirement or for whatever reason, those posts are not filled. If they are a lower level post, you only fill a post of a specialized nurse and a post of a doctor. Now the question is, who will clean the facilities if all those general workers, if they vacate their position, they are not filled? So we are of the view that the public protector is showing the line where this thing should be going to. Because in her recommendations and findings, the MEC or the treasurer is also involved, which then give us a leeway to say we are now having a document that is official to hold the government responsible, that the treasurer needs to uplift this moratorium that has been put on employing nurses and other health professionals who are needed in the health system. So there are deadlines that the public protector have given the department. We are observing those deadlines very closely because we want to see the department's reaction to this. What are the plans and what are they going to do? Even the treasurer. The premier is also involved because this matter, it is not only for the Department of Health, but it's for the whole government to look into it, that when you cut budgets, you cannot cut budgets on health, because when a patient goes to the hospital and don't get the assistance that a person must get, that person is going to die. So you cannot then compromise on the health of people versus the issue of saving money. We are saying when it comes to cutting of budgets, the health department must not be touched because it deals with the health of our people. So with this report, it gives us the way forward now that we need to have a robust debate with the premier, with the treasurer, including the MEC of Health, so that we are able to then uplift this moratorium that is compromising the health system.
Mandla, do you have faith in the health department that they will action some of these recommendations or take them seriously since you've been, in contact with the department for so long?
We cannot say we don't have faith in the department, because when we presented our issues, when the current MEC of Health, Nomakuku Smelane, came into the office, she did not dispute the challenges. She acknowledged the challenges, but citing that it is beyond her, because some of these issues needs the intervention of the whole executive. Now that the citation by the public protector is referring this matter to the doorstep of the Premier, to the doorstep of the Treasurer, unfortunately, they cannot ignore it, because in our view, the public protector are not only recommendation, but they are mandated that the Department of Health, together with the Premier and the Treasurer, they must act to it. That is why there are timelines that they say, you must give us the feedback on this issue, how far you are, so that we observe the progress. So we do have confidence that the department, they will not ignore these findings by the public protector. And we need to emphasize this point. Public protector did what we call their own initiative in investigating these matters. They were not influenced by us, but we are urging the public protector to say what they've discovered is just the tip of the iceberg. When you go to other hospitals in KwaZulu-Natal, you'll find situation that is worse than what the public protector have discovered in the 4 institutions that they've visited. Because the situation is dire, the situation is very compromising when it comes to provision of the health services to our communities.
Mandla, just a quick one for me. I mean, in your statement, you're saying you're calling on the public. You're happy about this report because you're saying the general public now can at least understand it, but considerate towards your members in the hospital, in the hospitals. Are you saying that the general public was blaming the nurses, the general staff for the state of the health system in KwaZulu-Natal?
Indeed, what has been the practice with our communities, when they come to the institution and they get the poor service, the first person to be blamed, and it has been created by the politician. I will quote our former MEC, Dr. Domo. At some stage, he pronounced in the media that when patients go to the clinic and they don't get the medicine, they must ask nurses for the money to come back the following day, which was misleading because nurses are not responsible for procuring of pharmacy medication. But the picture that is created is that anything that goes wrong in a hospital, it is a fault of a nurse. I'm talking about the IT situation that is affecting the province. You go to records that the public protector discovered that patients' records are not put in a correct way or the system is not working. Where a person comes and waits for hours and hours to get their card issued out, they take out that anger towards our members who are nurses, who have nothing to do with issuing of cards, but that is a systematic problem with the clerks. Now we are saying to our members, these findings are saying there's not enough personnel in the workplace. Now, when you come to a ward and one nurse is supposed to look after 50 patients, we are asking the community or the patient's relative to understand what our members are going through, because in a ward that must have 5 nurses, you find that there are 2 nurses. But these 2 nurses must execute their job to the best of their capability. Then when one thing goes wrong, there's no one who understands what these nurses are going through. It is all viewed as these nurses are not caring, these nurses are not doing their work. So this report is pointing to the right direction, that the communities needs not to keep quiet when poor service is being delivered to their families, but they must take it further to be part of these community structures that are in hospitals, to say why there's a shortage of staff. Because the shortage of staff is the outcome of all the problems that our communities are suffering, from ranging from waiting times, ranging for the quality of care being given. It is all coming from one point of staff shortages.
All right, thank you so much for speaking with us there from KZN. That's Mandla Shabangu, is Denosa, of Denosa from KwaZulu-Natal. He's the provincial secretary.